Hey, Brandon Steele with ChiroUp. I'm going to talk to you about a great journal article that I just read, and I want to bring a little clinical insight that I use in my practice. And that is counterforce braces, when used for the elbow for lateral epicondylitis and lateral epicondylopathy, work great. We use these all the time. They are phenomenal at changing the orientation at which the tendon pulls upon the bone. So you put that brace across here, it compresses down that tendon, and it changes which fibers that attach to that bone get the most force when you're using those wrist extensors. So for both of those conditions, it is great in the short term. In fact, that paper was between 2 and 12 weeks, great short-term reduction in symptoms. However, that is not a great treatment strategy. That's good to get the symptoms to go away, but don't think that you're done. You can't just walk around with a wrist support for the rest of your life. Make sure you match the diagnosis with the treatment. So yes, we can use that to get the symptoms to go down, but don't forget about the diagnosis. The diagnosis for lateral epicondylitis is inflammation, irritation, chemical inflammatory mediators. We need to knock that down. I don't care if you use supplements. I don't care if you use ice, ultrasound, rest, whatever it is that fits into your treatment strategy, use it. If it's lateral epicondylopathy, that is a chronic degenerative condition that needs to be dealt with chronic degenerative treatments. We need to strengthen that area. We need to build up capacity within that tissue so we can make sure that we can get that person out of pain and then build them back up so the problem doesn't come back again. We're going to use isometric strengthening. We're going to use eccentric strengthening of the wrist extensors. We're going to use other things as far as creating a controlled inflammatory response like Graston, like Factor, like cross-friction massage, all those things that we do so well as far as tough tissue. And then, of course, don't forget about being a chiropractor. Manipulation works wonders with manipulation of the cervical spine and also of the radial head in these conditions. And also consider other strategies, the McKenzie directional therapy of the elbow. We have tons of different tools to help get these people out of pain. The counterforce brace is phenomenal as far as taking people out of that short-term pain, but don't forget about that diagnosis. Don't just treat people based on pain. Make sure you're solving the problem, not just solving the symptoms.